Hi, everyone. Thank you again for joining us. We have a great crowd with us. We've got about 150 or about 140 participants so far, and it looks like more people keep coming into the room. So I want to get us started on time, but I know we'll have folks joining us as we move along here. My name is Dan Parish. I'm the Vice President for College Advancement at Colby-Sawyer College, and really grateful for all the interest in today's session. We have people from all over the region joining us, and we were just discussing, we've got a few people from overseas joining us as well, some New London residents and Sunapee residents who are out of the country. So thank you for taking the time. I have no idea what time it is in Egypt, but thank you for taking the time for joining us, those of you who are joining us from outside of the country. Before we begin, I have a few details to share just to be sure that you know how to operate the chat and know what you're doing during the webinar. Today's session is being recorded, so we will share the recording with you via email by early next week. Please use the chat text function to let me know if you're having any problems hearing our speakers today, and we will try to respond and help out in whatever way we can, as long as it's something on our end and not something on your end. Just a reminder that you can change your view by selecting the options in the upper right-hand corner of your screen or your mobile device. And you can open the chat and the Q&A functions by selecting options at the bottom of your screen. So if you move your mouse or touch the screen, you'll be able to see the options down there. We received a lot of questions in advance of today's webinar, so we're going to do our best to answer as many of those as we can. The speakers will include some of those in their opening comments. And if any questions come up for you during the program, please submit them either in the chat or by using the Q&A function, and I will keep track of those and share them with the speakers as I can. We're very grateful to the 4 leaders from our region who have joined us today to discuss. Just move our slide along here, sorry about that. Very grateful to the 4 leaders today from our region who have joined us to discuss the ways that their organizations are responding to the changing circumstances presented by COVID-19, and to share some of their thoughts on the plans that they are making for the months ahead. Each of our panelists will share some opening comments to get us started, and then I will rejoin the conversation to relay your questions to them. Tom Manion, who joined New London Hospital as their new president and CEO in early March, will be our first speaker. So Tom, first of all, welcome to New London, and thanks for joining us today. We'll hand it off to Tom now.
Thanks, Dan. Yeah, it's been an interesting first few months in the job. So I started on March 9th. I think it was 3 days later, the World Health Organization declared COVID a pandemic. So not exactly what I was thinking my first few days in the job were going to look like, but it was a very interesting start nonetheless. So I have to say it's been wonderful joining this community, getting to know our employees, our community members, and New London Hospital has done a really fantastic job, I think, being prepared and responding to COVID. Right now, I think it's safe to say we've had a lot of changes that we've worked through, things like screening at our front entrances. For a while, we had our OR shut down. That is now back open and going very well. We have great personal protective equipment, stores and plans and protocols in place. We have the external screening system set up for our respiratory patients who are coming through that may be COVID positive, so we can keep them separate from our general population. And, you know, it's just been a really awesome time to see the organization, the nurses, the providers, the environmental service workers, and everyone in between has just really stepped up to meet the challenge of COVID. And I think we have really great plans in place going forward, being part of the Dartmouth-Hitchcock Health System, working with the leaders there, and then partnering with community members here in New London. Just the other day, meeting with our police chief, our fire chief, and our EMS director here, just talking about how we can support each other and continue to do what's best for our community and to be as prepared as we can be as COVID continues to evolve here in the United States. So overall, I think it's been, like I said, a really interesting start. I think we're really well prepared here at New London. We are open. We are seeing patients. Please know we have taken every single safety precaution that we can put into place to come and see your providers. We are going to make sure you're safe and that our environment is clean and sterile. But yeah, it's been an interesting start, and we're ready to serve our community.
Great, and I think we're going to move on to Kim as our second speaker.
Great, thank you. It's very happy to be here with everybody. I guess I would start by saying that the town offices were closed on March 19th. Back then, I never would have dreamed that we would still be closed to the public today and going into the future. I mean, we do not have set plans for reopening, but I can say that during our office closure, staff have been available for the public to call and email, and we've been able to transact all business that way. We certainly miss seeing members of the public come into our office and interact with us, but it was something that we felt we really had to do, and I believe most of the 234 towns and cities in New Hampshire did the same thing. So as we go forward, we're thinking about ways to reopen to the public safely. It will likely include things like by appointment only for a little while, meeting with staff in larger rooms and those kinds of things to make sure that we observe the social distancing requirements that we're all trying to maintain. Our police, fire department, health officer, emergency management director, all those first responders have been working pretty much nonstop since this all began. We've collected the personal protective equipment that we've needed. The state of New Hampshire, after some weeks of ramping up, really got into it, and we now have quite a bit of material that will serve all of the employees. And we're also helping our partners, COA, the VNA, anybody who needs protective equipment, we're trying to help them as well. Early on, we shared some items with Hannaford's to make sure that their staff had equipment. So I would say things are going very well, all things considered, and I think that's mainly due to the fact that the citizens of New London and the partners that we have been cooperative. Everybody seems to be understanding that these are very difficult times. So they have been working with us, and I hope that continues. One of the main things that we had recently, maybe some of you have heard about it, were the beaches that we closed. So that happened last week when the first responders and myself and the health department and others felt that we just couldn't open the beaches for Memorial Weekend in a safe manner. I'm happy to report that last night the selectmen agreed to reopen the beaches. We have some different protocols in place to help ensure the safety of people that are going to be enjoying the beaches. So, and we'll have information on that online, and people can certainly ask questions, but we're happy to say that the 2 New London beaches are open to New London residents to enjoy. And going forward, we understand getting outside is very important. That was really the theme of the people who disagreed with the selectmen's decision. They're all pointed to the fact that people they feel like they've been shut in. They've been asked to stay at home due to the governor's order, which I think in large part people are doing. They need to get out, and they felt that being at the beaches was a good way to exercise and get fresh air. We heard that, but again, we wanted to make sure that we could do it in a safe manner. So I'd say generally, things are going great here in the Selectmen's office, due in large part to the partners we have with the college and the hospital and the school district and the nonprofits. And anybody who has any questions should always feel free to call my office or any of my department heads. So thank you very much.
Kim, thanks so much. And Winfried, I think we're going to head to you next.
All right, thank you very much. Welcome to this broadcast, and I appreciate the opportunity to represent the school district. We have used this forum in a much smaller scale in the past to just exchange news and get together as town leaders. Has taken quite a bit of an hiatus in recent months. So I'm glad that we have the opportunity to have that dialogue, and also I'm very excited about the interest level in town and the region. I find it very difficult to stay with the 2 or 3 minute introduction framework to describe essentially a reinvention of public schooling. But I'll give it a shot. When we had actually during February vacation, if some of you may remember, our first exposure to the COVID-19 crisis, because we had a school-sponsored trip to Italy, France, and England, where approximately 38 students and staff had planned for 2 years to go there and have a cultural and language exposure. We were We were very concerned about them returning. We asked them to self-quarantine. Luckily, nobody got sick. They apparently just ran in front of the crisis and the illness that spread over these countries. And then really after March 13th, when the executive order came out to close schools, we really had to reinvent public schooling. In my mind, we had about 2 days to prepare to go fully remote. What helped us in our circumstances is that we are the school district that invented the blizzard bags in New Hampshire prior to my tenure here. And we had really for our middle school and high school quite a bit of practice with remote instruction, at least on those snow days. What was completely new was elementary schools. First of all, the students as well as the teachers really did not have experience with that blizzard bag model via computer and internet. They have risen to the challenge. They have, in fact, from preschool on to 12th grade, everybody is engaged in one way or another with remote instruction within a very short period of time. Our preschoolers do cooking lessons with their teachers, and we have storytelling, and we have remote instruction in all the basic subject areas. What drove or determined our approach here were 3 key concepts. One was safety, one was equity, and one was quality. And in everything that we tried to do and have put in place, these have been the guiding principles. We wanted to make sure that our employees, our students, our families are as safe as possible while being taught and while being students and involved in the public school system. Equity is a very difficult concept because we have difficulties in some of our areas. We cover 7 towns where internet access is difficult to obtain. So to make sure that every student has the same opportunities to participate in remote instruction, we needed to be very creative. We worked with some of the companies to get hotspots into the families' hands so that they could circumvent spotty internet and cable service. So that has worked. It's not 100%, it's not perfect. It's certainly not perfect for every family, but it helped us doing that. Quality, again, as a guiding principle, we're inventing schooling via remote instruction is fraught with some problems. There's no experience. There's really no roadmap for this. So we have experienced many successes. We also have experienced frustrations. I would probably assume that many of our parents and students had very similar experience. Overall, though, I want to give a great shout out to all our parents and our students for rising to that challenge. I know it is extremely difficult to try to do a job from home or to go to a job and know that your kids are at home and have to study, learn, and be engaged. Our teachers have done a yeoman's job in trying to really tap in and make contact with every student. If a student falls off the radar for a day or two, the teachers use a variety of methods to get in touch with them and re-engage them. So while every school did do it a little different and had different schedules, overall, we tried very hard to provide as much stability and predictability for our families and our students. We tried to address social emotional needs. We will continue to do that over the summer. Our clinicians, our school psychologists and counselors and social workers got together and have devised a plan to be available upon request to every family, every student, if they experience anxiety, depression, or other social, emotional, and mental health issues. So it's just a phone call away or an email away, and we can do that over the summer. Lastly, summer planning is beginning. As you know, our last day of instruction is June 2nd. It's just around the corner. Kids will have 3 more days to finish their work, to get in touch with their teachers until June 5th. And then the week of June 8th through the 12th, everybody in the district is going to be engaged in assessing what worked, what didn't work, in those last 3 months, and then actively plan 3 scenarios really about reopening. And one of those scenarios is the one that we hope for all, is in person, we go back and do school as we are used to. It's probably less likely than other scenarios, but we'll keep planning for that event as well. The other one is go back to remote instruction, continue essentially what we're doing, learn from the experience that we've had the last 3 months, and go into August, September, or however long it takes to reopen in a physical manner. And then the third option is somewhat of a hybrid model where we're facing significant challenges in terms of staggering start times, having partial opening, and continue with some sort of remote instruction. This is, again, if you look at some of the CDC recommendations, a huge challenge, because to reduce and create social distancing on school buses, in cafeterias, and hallways is an enormous task. I don't know whether you know, we're driving about 4,200 miles every day to get our kids to school. If we had to double that, we would just not have the resources to do that. So that's what will keep us very busy over the summer, and that's what we're trying to create with as much input as we can possibly get. So thanks for giving me the opportunity to describe that, and I'm looking forward to some questions.
Great, thanks so much, Winfried. Really good information. And last, we'll go to Sue Stuebner from Colby-Sawyer College.
Great. Well, thanks so much for being here today. It's great to see such a great crowd. And, you know, my 4 years in New London at Colby-Sawyer, I think they're really marked by collaboration between the partners. And so it's really a pleasure to be here with my colleagues. Really a similar story to what Winfried just described at the school system. You know, we had to rapidly in mid-March make a decision about how to finish out the academic year. And so we were, our students were on spring break the second week of March, and we ended up extending it by a week so that our faculty could share best practices in terms of how to convert their face-to-face instruction into remote learning. It's something that we do a little of at Colby-Sawyer, but we're really known much more for our face-to-face instruction, so we had to ramp up really quickly. Our faculty did a phenomenal job of converting those syllabi and their courses of all types. I mean, you think about art courses, science courses, regular lecture courses, you know, all different types of modes of instruction into remote learning, so that our students could finish out the semester in that way. You know, I think one of the things that was so difficult about March and early April was just how quickly things were changing. You know, we originally thought we might be able to bring the students back in April to finish out, but that quickly changed. And so it was hard to be our senior leadership team and board just making decisions when information was changing so quickly. I think was one of the biggest challenges that we faced. But a huge shout out again to our faculty, who not only converted what they were doing to remote learning, but were often teaching not only Colby-Sawyer students, but also their own children at home, or juggling multi-generational households. Our students did a phenomenal job with being resilient, a lot of Zooming and staying connected. And you know, you suddenly are delivering everything from the college from our homes instead of in person. So that was really, I just want to thank our entire community for their work in making that happen. We are also spending an enormous amount of time planning for the fall. We are also doing some scenario planning, looking at different academic calendars. A couple of those calendars would have students here face-to-face instruction, but would have them leaving at Thanksgiving so that they would not have to go home and then come back, and potentially when things might be ramping up again. as we look at, what principles are guiding those scenarios and safety for the community, not only our own at Colby-Sawyer, but also New London is first and paramount. We know there's a strong desire by our students to be back on campus, and so we're hopeful that they'll be willing to put some safeguards in place or understand what it means to be a really good community citizen in a very different era than they're used to. And so we would have testing in place, hopefully in collaboration with New London Hospital, as well as potentially LabCorp, a company we work with now. We're working with an app that would allow students to flash a green if they have answered 5 questions, in the right way in order to enter the classroom. We're looking at density in the residence halls, as well as the dining halls, and ways to make social distancing possible. So lots of different factors that we're looking at, but we're hopeful to be face-to-face in some way, and we hope to have a decision by mid to late June at latest.
Great. Thanks to all of you for helping us get started. Some of your comments have answered some of the questions that were submitted early on. And Tom, I want to start with you with just a broad question that was raised earlier in the week. You mentioned meeting with the fire chief and the police chief, working together. And one of the questions that has come up is just, you're facing some really big decisions, all of you. And we're wondering about how you share information with others in the region, but also, are you collaborating with and getting information with other people who are in your professional circles, people who are CEOs and presidents of small hospitals in communities like ours? How does that inform what you're doing now, both with local leaders, but also with those you work with in other places?
Right. No, great question. And so the short answer is yes, we are absolutely collaborating. In most cases initially on a daily basis, initially actually twice a day. We've had the New Hampshire CEOs of all the hospitals would get together on daily phone calls. We've actually pared that back now to a couple times a week, but we're still having those phone calls. And then within the Dartmouth-Hitchcock system itself, we're now meeting once a week through a Zoom-like platform. But we talk, initially we're meeting again every day, talking about what kind of things are we doing, what kind of protocols are we putting in place, how can we make sure we're assuring the safety of our patients, our community, and our staff. I think if we can't take care of our staff, we can't take care of our patients. And we really need to make sure that we're mindful of screening and testing and things like that. I saw one of the questions in the chat came up, are we testing our employees? The short answer is we have the capability to. We have protocols in place to make sure the testing is appropriate. And we're screening people every day. We're asking them the right questions every single day. If you're an employee, you walk through the door here, you get the same questions that our patients get. We take your temperatures every day, and we make sure we're gonna mask you and keep people healthy. Mask, I know that was one of the other questions. We are requiring everyone. You're seeing I'm not wearing one now because I'm in my office with my door closed, but we are requiring everyone from employees to patients to have a mask when they come in our doors. So we are also working, as I mentioned, with our local contacts as well. I actually just had a phone call with Kim the other day to connect, just chat, see what we can do to support one another, and making sure we're rowing in the same direction. We certainly don't want to put policies in place that are not going to be aligned, that aren't going to make sense. And I think I can say with certainty that everything we've done has been very much in alignment with other things being done here in town. Emily Cobb, Jay Lyon have been fantastic partners. Sean Riley, our EMS director. It's great communication, and we recently just sat down for an hour just to check in and see how we're all doing. We also have an incident command structure where we have, again, a variety of team members that are connecting both here at New London Hospital, but also with the town and other incident command structures throughout the state to make sure we're managing things like protective equipment, personal protective equipment, making sure that we're communicating with the latest protocols and what the latest CDC guidance is and how we're supposed to be testing and what kind of protocols we need to update and change. The screening protocols have changed so rapidly. We've had high touch communication early on. I think at one point we had 3 changes in a week of how we were screening people as they were walking through our doors. So it's been a lot, and we've had to stay really, really communicative in order to do this well. And it's been a challenge, but I think we've risen to it and have done a good job.
Great. Thanks, Tom. I'm going to get to a rapid fire set of questions that have to do with openings and specific things. But Kim, you mentioned early on, this is related to the question I asked Tom. You mentioned early on gathering protective equipment and masks and sharing with Hannafords. And is that still, are you hearing from organizations in town, the nonprofits and the other organizations in town, whether that's still a pressure point, or have we passed that now because so many people have been making masks and sharing them? Are you still hearing some of that locally?
Not as much, no. I think that we are in a much better place. The state has really done an excellent job, I think, of gathering PPE. And they have shared it with nonprofits as well as towns and cities. So I think we're in a much better place. We still continue to buy things if we need certain things. But I think that the availability of PPE is there. And I think people are feeling much more confident than they were even 3 weeks ago.
Great, great. So I'm gonna go from the broad to the narrow for a couple seconds with each of you. There are a few questions. Sue, we've received probably from 5 different people both today and during the week questions about the Hogan Athletic Center. That won't surprise you that people are interested if we have plans for Hogan. So can you share a little bit about the thinking around when Hogan will come back and what that will look like?
Yeah, the governor, I think either earlier this week or perhaps last Friday, did indicate that gyms could reopen for one-on-one instruction and for small classes. And so we are looking to reopen hopefully by mid-June just for those purposes. The classes will likely be in the gymnasium where people can spread out rather than in the small classroom area. And there will be personal training options. So that will be the first wave, and then we'll have to just wait for more guidance and see how that goes.
Great. Kim, same sort of theme, different building. Questions about Tracy Memorial Library, and if you know what the next step is for the library.
Well, I have talked to Sandra Licks, who's the library director. She and her trustees, they are in charge of making that decision. And I know they're working hard to figure out ways that they can open. I think they'll likely start with sort of a drop-off, pick up and drop off. The town buildings person installed some plexiglass for them. And we have done similar things in our offices. So they are working hard to gear up. They've gotten some PPE as well in preparation for when they can open. But there's no set date, but know that they are working hard to get to that place.
And I know they've been sending out some updates to folks and keeping people looped into what they have available for resources and what they're doing next.
Right. Yeah.
Yeah. Winfried, some question. Will you tell folks a little bit about what you've done for commencement for the school? Because there are a couple folks online who aren't aware of what you've done and asked about a commencement date. And so I think people would be interested in hearing. You guys have been doing a lot of work this last couple of weeks on that.
Yeah, this has been a big discussion in the school district as well as with the staff. Again, on a most abstract level, we tried to again reinforce the quality, equity, and safety. And we tried to create a situation where we are not in violation of the governor's order of limiting assemblies of people to less than 10 or 10 or fewer. So that's when the brainstorming began, and then we looked at postponing a graduation ceremony into later of the summer. And we were really concerned that while many students might be able to come back, we would certainly run a risk of not making this available celebration for everybody. So the solution we came up with, and quite frankly, I'm extremely proud and happy how this has worked out. We engaged a professional editing and filming crew. We did set up 3 days of graduation experience, 10-minute slots where every child had an opportunity to walk into the auditorium with their parents to pomp and circumstance in full garb, have their name read and cross the stage, pick up their diploma, have the professional photographer take a graduation picture of them, then reunite with their parents, and then have more photo opportunity out in the cafeteria for a variety of family shots. So we spent 2.5 days doing that. We pre-recorded our speeches, and we expect on June 13th, graduation date at about 10:30, that this video that's currently being edited to go live and be broadcast in lieu of a physical ceremony. And again, one of the discussion points that we had was if there is a safety clearance by July 15th, we picked that date because we had to pick a date. If we are able and authorized to have a large assembly of 1,000 or 1,500 people, we will do a complete redo, because we know how to do a regular graduation. That we can pull this off probably in 2 or 3 days. So if we have clearance on the 15th of July, then on August 1st, we will have our complete live graduation ceremony on the athletic field.
Great.
So I think the solution is a very, very good one, high quality, and I'm looking forward to seeing the whole production.
Great. Thanks for that update. I'm going to stay with Sue and Winfried for a second, and then we're going to come around to some broader questions for Tom. Sue, there was a couple folks asked about the Colby-Sawyer commencement plans, and I think some folks online know the answer, but will you let folks know what we're planning right now for commencement at Colby-Sawyer?
Sure. We worked really closely with the senior class officers, and for them, the biggest thing was having some kind of ceremony. And so we have picked August 8th in hopes that that will be a time where we can have a group gather. It'll be likely a one-day event with our scholars and leaders ceremony in the morning, and then the commencement in the afternoon, and a chance for our seniors to hopefully come together. You know, unfortunately, we'll probably have to limit the number of family members that they're able to bring with them just because of social distancing, but we're working really closely with the senior class to try to honor their wishes and also do so in a safe manner. So that's our plan at this point.
Great. And I know there's not a clear answer for either Winfried or Sue to this next question, but this week, during the week, we received several messages from folks who are interested in fall sports for different reasons. So Sue, I know you've had some conversations with the presidents in our athletic conference. And can you just comment on the kinds of things that you're all trying to consider as you look to the fall and think about whether the college will have an athletic season?
Sure. Yeah, the presidents of the GNAC have been meeting about every other week just to continue to monitor this closely. I think best case scenario, we'll have athletics that start in late September. There'll be a lot of monitoring of our student athletes. One of the trickiest things about athletics for the college is that we've got schools that are in 5 different states. And so we have Massachusetts schools that are really concerned about whether they're going to even be able to open face-to-face versus Maine, New Hampshire, Vermont, and Connecticut schools that are all working very hard to try to be face-to-face. So there's a lot of unknowns at this point. I think we'll know more. The Management Council of the NCAA meets in early July, and they really forced our hand for the spring, and I expect that we'll get some guidance from them in early July on what we'll be able to do. But I think best case scenario, it will likely be a delayed season if we're able to have one.
Yep. And Winfried, same question. Just I know that it's out of your hands in lots of ways, but do you know sort of where folks are in thinking about fall sports for the high schools?
Well, I think we're all united in wanting it to happen as soon as possible. Our athletic director, Scott Fitzgerald, has worked very closely with NHIAA to look at what can be done and how we can do this. In the meantime, he has worked with our coaches. They have done a wonderful statewide, really, professional development program with college coaches across the country to get more skills and to stay current. In terms of what a fall sport could look like, I just looked at the CDC guidance, and it seems to me that this is thinking that may not be easily translated into reality. When you have mouth guards, and then you're supposed to have a mask, and then you're supposed to run on a football field, that may just not be a practical solution. If we can, we will have sports. If the safety and security is indicating that we should not, and that we put our kids at risk, or the spectators, if there are any, I cannot subscribe to that. And I'd rather be safe than sorry in that case. But it will also most likely go along with what kind of model we have for our regular instruction.
Right. Just to share a couple comments from the chat and that came in. One thing about Colby-Sawyer events, so that folks know, there have been some questions whether we live stream or share those, and almost all of our athletic events are live streamed, and so if we do hold them, folks can watch. And then we did have the suggestion or the question about whether anybody's thought about, for either the high school or the college, drive-in theater style viewing of athletic events, where you pull your car up to the edge of the field and you stay in your car and watch from there. And both facilities have some ability for that. So I wanted you to know we've got that suggestion out there. And if we do end up having games that folks are interested in seeing if you can make arrangements for folks to watch from their cars. So I wanted to share that so you knew that was one of the comments. Tom, I'm gonna shift to you for a second. We've had questions earlier in the week about capacity and testing, and also just about whether there have been cases either in New London or that have been identified at the hospital. So can you start with that part of it? What's our situation in New London and Sunapee, and has the hospital had to treat patients who've tested positive?
Right, great question. So we've been really fortunate here in New London that we've only had a handful of patients that have come through that have been positive. Most have come through in our external, we had a tent that eventually changed into one of our trailers to screen folks in externally. We've only had a few people come through who have tested positive. Most of them were sent home because they weren't sick enough to go anywhere else. They had some respiratory distress, but nothing significant. We have had a few folks who have hit one or two people who have hit our ER and had to have been admitted, but those folks were transferred out really quickly. So one of the things with New London Hospital, we are part of the Dartmouth-Hitchcock Health System, and we have a very planned out, really detailed surge plan and surge response. And we are very low in our surge response right now. We don't have a ton, fortunately, in New Hampshire, or at least where we are in the Upper Valley area, a ton of COVID cases right now. And as a result, we are lower in our surge planning. For New London Hospital and for, I believe, Alice Peck Day, our goal is to stay as COVID-free as possible and to have Dartmouth-Hitchcock Medical Center and some of our other affiliates really be the places that manage COVID patients. So we are very lucky in that the few that we've had that needed to be admitted have been done so elsewhere. And again, we constantly clean. We do terminal cleans. We use significant disinfectants. We have folks who are walking through our hallways every day, multiple times a day with disinfectants, wiping handrails, doorknobs, everything. So it is extraordinarily clean here. We've had very few COVID patients come through, and those who have, we've seen them outside for the most part in our external location, and they've been sent home. So we're very lucky, and knock on wood, I hope we stay that way. In terms of testing, in terms of actual testing, Dartmouth is, so we do antibody testing right now. We can do a nasopharyngeal and we'll send that to our lab. They get results back to us usually within a day. Pretty good testing. They can do 1,000 tests a day, and they're able to serve significant portions of New Hampshire and Vermont, for that matter, to help with testing. So we also have, as we get closer to getting better supply chain, better validated tests. Right now, there's a lot of things out there that aren't fully validated by the FDA, UA approval, and I won't go into the details there, but there's testing supply chain issues as well. So trying to get kits for rapid testing is slow because there's so much demand across, well, really the world. We're getting there. We have plans for that. We want to make sure we get to the place where it's needed most first. I think Southern New Hampshire is having a lot harder of a time managing COVID. I think that attention needs to be focused. So those are our current testing. What we're planning for right now and where we're going. Great,
thank you, Kim. It may be way too early to ask this question, or maybe it's too late. We're not sure. The fall election. What are you able to plan for, and then what are you hearing from both the state, but also the parties and the folks who support and organize all this? What's happening in that conversation right now?
Well, that's actually a very timely question. Just recently, the selectmen designated the highway garage on South Pleasant Street as the location for the September 8th primary. Okay. The location was moved from Whipple Memorial Town Hall, where this town has voted for decades, because that facility is just not big enough to give us the spacing we need. So the town moderator, the supervisors of the checklist, and the Public Works Department, we all went over there and walked around, and we thought, yeah, we can make this work. We'll clean it up. We'll make sure it's ready to go. And so that will be where we'll vote. I see one of the questions asked about how we'll get the word out. We will, the state requires some notification, but we'll go way above and beyond that. Our supervisors of the checklist are excellent with getting ads in the paper. We have our municipal newsletter. We have our email list. They will be working with the college. We have always worked well with the college. Our supervisors have even gone over there to have signups, because we encourage students to sign up to vote. So the supervisors will do that. We'll get the word out there, and we encourage people to vote. We will have a safe and open area to do it. So we're looking forward to it. It'll be a big process. The state of New Hampshire continues to work on the particulars. How will people show their identification and when they're masked? They'll have a mask on, presumably. And so, how do we make sure to, who these people are? So all of those things are being worked on. Our town clerk, Will Kidder, is working closely with the state and other election officials. So we'll be ready. It's very important to New London that we hold voting properly, and we'll make sure it happens.
Kim, one of the questions you may have seen in the chat or in the ones that we received earlier was about absentee voting, specifically whether we'll do anything at the college and the town collaboratively to encourage students to vote absentee, so that we don't have young people waiting in line with older residents who might be in the risk groups. But I wonder if you can broaden that out more broadly, since people are talking about it a lot in the news. Will there be any different approach to absentee voting? I'm not sure what you do to prepare for that.
Yeah, well, the state of New Hampshire, again, makes the rules about it. It used to be that you could only absentee vote under very strict circumstances.
Right.
Now, the state is broadening that. So pretty much, I think anybody who does not want to go to the polling place for fear of either getting the virus or is just afraid, will be able to vote absentee. Those details about how and the time periods for applying and all of that are being worked out. But we will encourage people because it will be better for the election workers as well as the voters. The
Right.
more we can do, again, and still have the integrity of the election observed. I mean, that's obviously critical, but the state is working on those kinds of rules that we will follow here in the town, all of the towns, but New London will as well. And so obviously we want as many eligible voters to vote. That's the idea here. And we're going to do what we can to make sure that happens.
Great. And I just want to go back to what you said at the beginning because it specifically addresses one of the questions. I know in my brief time at Colby-Sawyer that folks in town have worked really well with folks in student development at the college to make sure that the right information is shared back and forth. So if we've got a little more flexibility around absentee voting, where our students could absentee vote in their home community or here more easily, if we've got our students here and that's the case, it'll be communicated pretty aggressively to them so that they know, because I know that the last few cycles, that's been the case here for sure. Yeah.
Absolutely.
There was a quick follow-up to that, Kim, but I think you've addressed it with I'm guessing the answer to this might be yes. You know, much like we have special times in the grocery store, has there been thought given to special times for at-risk voters, folks who have immunocompromised states and
Sure.
people in risk groups?
I will check with the town clerk. I'm not sure if that has come up. Here in New London, we vote 7 a.m. to 7 p.m. And I'm not sure whether they'll have some of those time periods, but it's a good question. I know it's worked very well in the grocery stores that have done it. So it's definitely something I'll bring back to the town clerk.
Great. Kim, Sue, and Winfried, this applies to all of you because you all touch these programs in some way. We've had questions about summer programs, summer camps. I know, we've got swim lessons that, happen with a couple of different organizations in town. The college runs not the college, but part of the college runs a day camp, and the school district has contracted out and had other people come in for summer programs in the past. So I don't know who wants to take that first, but are there any areas where people have made definitive decisions about not holding certain summer camps or the swim lessons, Kim, that happen in the different places?
So far for the town, we have said at this moment, no to swim lessons, sailing lessons, and those kinds of activities.
Yep.
We are working still on whether or not we can hold the day camp, whether or not we can have, little pods of campers with counselors at different locations. Unfortunately, we don't have like a big school with lots of classrooms that we can use. So we are working on that. We're trying to figure out how we can do it. We understand that there are parents out there that need a place for their children to go for the summer. And not only that, the students and the children want something fun to do. Our camp is very popular in the summer. So we will be making decisions on that in the coming couple of weeks. We used to start like mid-June on the program, end of June. So Scott Blewett, our rec director, is definitely working on that to see if we can hold it safely.
Great. Winfried, any response to summer programs?
For us, it was, unfortunately, we had to cancel our STEM camp. That's very, very popular. It fills up really quickly at the middle school. That's meant for incoming 5th graders as well as all the way up to 8th graders going to the high school. That's a clear loss, but that was an early decision because of all the preparation that goes into that. The other big program is our special education extended school year program for students that would be disadvantaged over the long summer break and need that consistency of services. In line with really all the surrounding school districts, our special education department decided to continue with most of our staff in a remote fashion, just to make sure that parents, students feel comfortable, and our service providers feel comfortable and safe to provide the services. Is it ideal? Most certainly not. Again, it's that the whole social emotional piece that the social distancing brings along with it. We have heard this repeatedly from parents as well as our students, that what they crave most is their company, each other's company, and that essential element of education where a teacher can see the child in the classroom or can have an activity around advisory or summer camp. We just can't do that at this point, and that's what comes up again and again. But so our extended school year program runs remotely, and STEM camp is canceled at this point.
And Sue, the Hogan Day Camp, I know that's a work in progress, and still folks thinking about, like Kim said, what we might be able to do.
Yeah, we're still, kind of in the planning phase there. The governor is supposed to come out with some guidance for camps, I think potentially even this afternoon. And so we've been talking about a lot of different options, but waiting for some guidance there as well. But in the meantime, having to hold off, unfortunately, until we can sort out some of the questions that would enable us to say yes.
Winfried, we had a really good question about the food support that's been available during the school year for families in need. And after you answer this, Kim may know of some other resources, but I don't know whether that continues through the summer. Can you just tell us a little bit about if there's an end date to that, and then we can maybe talk about other resources that are available.
Yeah, this is another one of those very creative solutions. I'm very proud of that. We have early on, really the second week into this, we were notified that there was a waiver available from the federal government to feed not just children and students on free and reduced lunch, but really extend that to everybody. So our food service company, Cafe Services, with our bus company support and the school district, we ramped it up, and we're currently feeding about or sending out about 500 meals a day, 7 days a week. So our buses line up at the middle school. We use the big middle school kitchen for our food service to prepare those lunches and breakfasts, and distribute them along our bus routes. Everybody can sign up. The program currently ends on June 30th. I'm glad how many people spoke up and contacted us, and it kept Cafe Services busy, and it also allowed our bus drivers to continue to be gainfully employed, because obviously we need to allow them to fulfill their contract with us. Although the bus company has been able and willing to modify the contract because of the lesser usage. So they stepped up and helped us out there. And food service is a contracted service anyway.
Yeah. Kim, I know in the past, when the school year has ended, there have been some groups in town that have provided food. There's been some bagged meals that can be, box meals that can be picked up and things. Do you have a sense of whether any of that's changing for this summer? I know that there's some groups that have filled in and helped plug some of those holes.
Yeah, there's a food pantry that's run by the Kearsarge community, the various churches in town and in the area, out of the First Baptist Church. They've been doing an excellent job since this, well, it's an ongoing food pantry, but they really ramped up their outreach to the community to encourage people to utilize the services and the food that they have there. People drive up to the food pantry, and the staff will come out and bring them food. They've done an excellent job, really helpful in the community. So we've given their name out. We did a little bit of an article in Municipal Matters just to get the word out. And I mean, I take my hat off to them. They're doing an excellent job helping the people in New London and the surrounding area. All of the towns in the area go there when they need it.
Great. And I know down the line, there's some collaboration going on between the college and the hospital, a couple of other organizations in town, that by late this summer, there may be some fresh produce and things like that folks can take advantage of as well. So we'll keep an eye on that and spread the word through the shopper and spread the word through the town and other organizations. There have been a couple questions that basically boil down to, we've got maybe 3 or 4 minutes left, and I'm not sure how to tackle this, but it basically boils down to what would you suggest to people for how they can help? So I don't know if that's a really broad question, and there are lots of different opportunities and lots of areas of need. Tom, go ahead. You've got your hand up, so jump in there.
Absolutely. So one of the big things that's really, as a hospital in the United States right now, we were not immune to the financial impact of COVID to here in New London. So one of the things that you can do that would really help the hospital is you have options to continue to get your care. Don't delay it. Don't put it off. We can see you safely here. We have socially distanced. Our waiting room is very safe. We get people in and out of public areas quickly. And we also have options for telehealth. If you found a way to get on this Zoom, it's just as easy to get onto a telehealth visit with one of our providers. Almost every single one of our providers has been set up with telehealth. So we can meet you where you are. We can figure out a way to do it. It's really important for us that our patients come back and keep using our healthcare system. So I would ask people to, A, do that themselves, then B, go out and spread that word amongst your friends and folks here in New London. We do need those patients to come back. It's really important to us. And then the last thing I'll say is that we also have set up a COVID relief fund that is, you can go on our website and donate. That is a critically important fund for us as we begin to recover here as a hospital. So we have a lot of things to figure out. We are starting to slowly ramp up. Pretty much every other facet in our system here in New London is ramped up to capacity, except our outpatient visits here in New London. And so again, if folks could find ways to re-engage with the system, don't put off your care. We also don't want people getting sicker at home because they're afraid to come in. At the very least, we can set something up with a telehealth visit, and so we don't have folks get sicker and other issues become worse.
Go ahead, Winfried.
What really helps everybody is an appeal to please assume positive intentions. Every teacher loves to be with their kids. Every administrator wants to run schools the way we are used to it. I think every parent wants to send their kids to a safe place. And I can assure you from my many conversations and the experience of the last 3 months, nobody is trying deliberately to inconvenience families or to do something that's not in the best interest of kids. We have no roadmap for this. We are, like Tom said and Kim said and Sue, it changes every day. The most stressful piece of this is that there is no routine. Most of us get a break here or there when you go to a job and there's routine and you just do it because you're on autopilot. There is no autopilot in this situation. Everything has to be done new. Everything has to be considered 5 ways before we make a decision. So I think all of us, and I would include all of us, are really working hard to make it as painless as possible, but keep it as safe as possible, because none of us wants to be responsible for having someone who is exposed to the pandemic, to the COVID, and then feels any sense of it was our fault to do that. So that's why you hear me say safety first, and then the rest will fall in place. But assume positive intentions. We all try.
Dan, I would just add that, I think patience and, continued communication, this has been a great way for us to have some communication with the community. And, I think each one of us is the kind of leader that we welcome continued conversation. So if folks have questions about why decisions are being made or why amenities aren't open yet, please don't hesitate to reach out and just engage in conversation. We'd be happy to continue the conversation after today. I will also just put a little plug in for Colby-Sawyer also has a student emergency fund to help our students that have been affected by COVID. So That's just another way, similar to the hospital, that if you're so inclined, that can make a really big difference for our students whose lives have really been impacted by this.
And for the town, the help I would just ask that people continue to be as flexible and positive. I think assuming positive intentions is an excellent point. Our staff are really trying hard to serve everybody in New London and do it in a positive way. So if the citizens can just keep up the good work of being positive and working together, I think we'll get through this with the least amount of inconvenience and anxiety and stress as possible. And I thank everybody for helping out on that score.
Great note to end on, and thanks to all of you for taking the time, being so generous with your time today. We probably didn't answer all the questions that came into us, but we covered a lot of ground. You all were very honest and open, and a lot of really great comments in the chat, and a lot of good information shared. As I said, this webinar has been recorded, so by early next week, we'll send a follow-up email to all registrants. You're welcome to share the video link with anybody who you think will be interested in seeing it, and eventually we'll have it up on the college website, but I'll also ask my colleagues here, if they want to share it on their website, they can, and we'll provide everybody with the link for that. So thanks again for joining us. Hope you have a great afternoon and a safe weekend. Now that summer seems to have arrived here, and thanks again. We'll be doing more of these webinars, and if you learned about this one through our social media or via email, you'll be on our mailing list, and we'll keep you posted on what comes next. Thanks again, everyone. I really appreciate it. Take care.
Thank you.
Thank you.
Thank you.
Bye-bye.